we have not done the most important thing that we can do to make North Carolina citizens that don't have health care a better quality of life, and that is to provide them health care in a category that they don't qualify for now. You know, most of these people that will qualify are actually working. High percentage, I've seen numbers as high as 80% are working. They just can't afford health insurance. Health insurance is very expensive. And I think this is one thing that we can do that will truly make a difference. It's hard for some of my members in our caucus, and I get it. They represent their district. Healthcare is also a very complicated financing mechanism. I joke with people and tell them, my background is finance, but healthcare financing is unlike anything you traditionally or common sense think about. It is a really complex system of financing. So I've continued to push this notion that we can make North Carolina a better state if we move forward in improving access to care. And this is a way we can improve preventive care, we can improve mental health services in North Carolina. There's so many positives that we can get if we pass this bill, and that's why I'm still here out on that limb. And I would tell you that I appreciate the other primary sponsors who are also out on that limb, because this is not easy for many of our members to push this forward to try to get this passed, because we've taken a lot of criticism and a lot of hits over the last several years. Because it is so complicated, I'm going to have the staff kind of go through it. I would tell you there's two components in this bill. They're not necessarily related, but they are related. One part is the Medicaid expansion part, but the other part is referred to as the HASP, and that's the funding that North Carolina hospitals and providers can receive because we now are in a managed care environment. We could do the HASP, we could do expansion separate, but hospitals need some comfort level that we're going to move forward on the HASP funding and allow them to go back and retroactively receive those payments from the federal government, because we are now a managed care state, for which they then will help fund the state share, the 90-10 that's in this bill and that's in law today. They will fund the 10% state share. So, you know, the good news is there will be no state funds put in this program. In fact, the staff will tell you there's actually a benefit to North Carolina. We will see money coming in North Carolina to fund some of the state's hospital patients that are cared for, which will actually bring new money in. And so it's actually a net positive to the state. I've tried to talk about the economic benefits of this bill, and it certainly has huge economic impact bringing this amount of money into North Carolina in terms of helping us with a number of areas in health care. But when you get down to it, this is really what it's all about. It's about that person, whether they be a veteran or a farmer that's at risk of losing their farm because they have some catastrophic health care bill that they can't pay. It's really about helping the people in North Carolina. And I can say a whole lot more, and we don't have enough time, but when I saw this card, I realized this is really why we're here, and this is why we're fighting to pass this bill, to help people in North Carolina have a better standard of living, get better health care. Let's get them out of the emergency rooms. Let's get them into primary care practice. We now have a very good functioning system in Medicaid that's managing these patients a little differently than historically. And let's really make a difference in North Carolina.